Hello radiographers, hope you are doing good. In this video tutorial, I will show you how to do MRI of liver with dynamic contrast. So let's start. So right now the HEST localizer is running. The dynamic contrast is the process where multiple sequences are scanned in quick succession after giving the contrast injection so that we can get the arterial, portal venous and venous phase, and also a pre-contrast scan should be taken before the contrast injection. So now this HEST localizer is taken with breath hold. You can see in the left bottom corner that the scanning is breath hold and it's completed till the patient to release her breath. And now I am planning the T2 HEST coronal. This is multiple breath hold protocol, and I have taken 24 slices for the coronal image. I am planning on the sagittal and axial image and angle the slices with the angle of the liver and also the spine, and make sure that in the axial image that whole liver is covered, and then click apply. And now T2 has open. So now T2 HEST coronal multiple breath hold scan is preparing, and I have to tell the patient to hold his breath. When it's ready, you can see that a green play button, and after telling the patient to hold his breath, click the play button. Now tell hold your breath and start, and the image will appear in the progress step segment. You can also see a lesion in the liver. So this is the first step of this protocol, and now it's a break for breathing. And again tell the patient to hold his breath and click the play button, and the scan will start for 10 seconds. Now the coronal scan has complete. So now I am taking T2 trophy coronal breath hold, and it's a fat set protocol. Just copying the parameter from the previous T2 coronal, and that's it, and click apply, and it's preparing. All the notification comes in the at the bottom, especially in the left bottom corner, what is happening in the scanner. It's in the written format. Right now adjusting 3D SIM field map for T2 trophy coronal. That said breath hold, BH means breath hold and MBH means multiple breath hold. Now it's preparing and it's ready to scan. Waiting for user to continue. You can see that a green play button at the bottom. Now tell the patient to hold his breath and start the scan by pressing the play button. You can see this is a beautiful trophy coronal image, and it's beautifully fat saturated, and this is a single breath hold protocol. So my two coronal scan have been done, and now the axial. So right now I am planning T2 has transverse multiple breath hold. And for this I have to plan on the coronal image and the sagittal image and make sure that the axial slices covers the whole liver from the upper part of the dome of the diaphragm and at the lower end at the mid kidney, so that the whole liver is covered. And for T2 trophy transverse fat set, just copy the parameter from T2 has transverse and click OK, and then click apply. And these are the coils. You can see that the coils are visible in the segment. Body coil used over the upper abdomen, and also the table coil or spinal coil. Now I am planning for the diffusion, and there is a navigator, respiratory navigator for the diffusion protocol. So you have to place respiratory navigator over the patient's chest, so that the trigger protocol can be taken. Now patient is holding his breath and I am taking the T2 hast transverse. And this is a multiple breath hold technique, so I have to take second time this scan, and again this is break. Now it's break time, and now tell the patient to hold his breath and click the green play button to continue. Hold your breath, and scan is running. Release your breath and breathe normally. So T2 has transverse scan completed, and now T2 trophy transverse fat set is ready to be scanned. Again, tell the patient to hold his breath, hold your breath, and press the green play button. Continue while patient is holding his breath. And this is a fat set, trophy fat set axial beautiful protocol. Release your breath and breathe normally. And now T1 flash oppose in phase transverse multiple breath hold ready to be scanned. Again, tell the patient to hold his breath, click the start button, and the scan is running. And this is a multiple breath hold, so you have to tell the patient 2 times to hold his breath, and release your breath and breathe normally. And it's a break between first and second breath hold. Again, tell the patient hold his breath, click the play button, and scanning is running for the second breath hold, and it's completed. So release your breath and breathe normally. So now it's diffusion weighted sequence will be start, and this sequence is respiratory gated trigger sequence, so no need to breath hold. It will scan automatically according to the respiratory graph. So diffusion weighted image sequences have 3 B value from 0, 500 and 1000, and it's preparing, and I am waiting to restart this protocol. Now it's scanning. It will take 2 minutes approximately 2 minutes to be finished. Now its time is increased to 4 minutes. Time keep changing because the respiratory rhythm may be changed by the patients. Patients sometimes take fast breathing and sometimes take slow breathing. So it depends on the breathing rate of the patient, how much time it will take to complete the scan. So after diffusion scan, you can see that there is post contrast and then T1 Vibe headset transfer dynamic 4. That means 4 scan will be taken sequentially. The first one will be a non-contrast or pre-contrast, and there will be a gap between the first and second dynamic scan, and in this time I have to give the contrast to the patient, and then second, third and fourth dynamic scan will be run. So I am telling you again, there is 4 dynamic protocol. The first one will be taken before the contrast is given, and in the first and between the first and second there will be a time gap and contrast will given then. So right now T1 dynamic contrast enhanced is preparing to be scanned. You can see the I am planning for the T1 Vibe headset transfer dynamic. So before starting the dynamic scan, you have to prepare your contrast injection and insert the needle to the patient's vein, and then you can also use injector if available, and if not available, a person should be inside the scanner room to push the contrast by the hand. And in this case I used a person in the scanner room to push the contrast manually. You can see the dynamic start. So I have to rerun this. Now the dynamic start fast scan is running, and you have to watch the time when the gap is between. Now it's the break time. Now give the contrast. Now give the contrast to the patient between this time. And now start the second scan, that will be arterial phase. Yes, the contrast is visible. Now the third scan, tell the patient to hold his breath, and now it's the break between second and third scan. Now start the third scan, and it will be a portal venous phase. All the scans are taken with breath hold. Now it's break between third and fourth scan. And the fourth scan will be a venous phase. For this, now tell the patient to hold his breath and start the fourth dynamic scan. Yeah, the dynamic scan has been completed. One is non-contrast or pre-contrast, and three is post-contrast. And among three, there are arterial phase, portal phase, and venous phase. And now another T1 Vibe headset transverse is open, and it will be a delayed phase because 5-minute delayed images scans are taken for liver for to see any contrast washout in the lesion. And I will also take a coronal for this, and now I will take a coronal image, and I am planning on the sagittal and axial, and now I am planning for the uh, so let's start the coronal. Hold the Ask the patient to hold his breath, and now it's running. Patient is holding breath, and T1 Vibe headset coronal is running. So you have to know that these Vibe protocols, T1 Vibe protocols, are actually 3D protocols. Okay, because the this slice thickness is 3, and the slice per slab is 72. That means there's lots of slices in the all the slab. So you have to do 3D work for post processing. You can see that the coronal image, post contrast coronal image, showing uh, enhancement of the livers and the portal veins, and also the artery and aorta and vena cava. So this is a good delayed contrast enhanced protocol. And another protocol, last one, is delayed transverse, that is T1 Vibe headset, and click apply, and tell the patient to hold his breath, and then click the play button. So this is the last protocol for this MRI dynamic liver, and this is a delayed one after 5 minutes post contrast. It's completed. So there is a technique to push the contrast injection. So in this case I have used 10 ml contrast followed by 10 ml normal saline. So if you can push normal saline after the contrast, you will get a proper contrast density in the liver and the aorta and also the portal vein, because some contrast remains in the veins and in the catheter. So you need to push all the contrast by the normal saline. Now it's time for filming the images. So I'm checking out the coronal images right now. Select the T2 coronal series and send it to the filming, and now go to filming, and in the filming I have to change the layout to 4:6, and also adjust the images to fit the segments, and I am keeping the reference image in all the segments at the bottom right corner, and adjusting the contrast of the images. So at this point I will just make the film, and watch carefully how much films I provide. And I'm also selecting the headset coronal, that is a TrueFi headset coronal. So I will provide two coronal. One is normal T2 hast coronal, and the another one is fat set coronal, Trophy fat set coronal. So these two coronal images are in 4 into 6 layout, so that the 24 images are fit in the films. You can write it down if you want how much films and which films I printed. So two coronal I printed, and now for I'm going for axial, and this is a T2 hast axial protocol. So I'm checking the protocol and select series, sending it to the filming, and I will also send the reference image of this series. And now I'm in filming and changing the layout to 4 into 7 so that the 28 images are fit in the film, and I have to delete extra images, extra 3 images, so that there is only one film remaining. I am checking out the reference images from the segments, but keep a one reference image at the last, and adjust the zoom of the image. Contrast, also adjust the contrast, and keep all the information in the first segment. This is T2 Trophy fat set axial. To print this, select series, send it to the filming by clicking copy to film sheet, and also find out the reference image and also send it. And like the previous one, it is in the 4 into 7 layout, so there is 27 axial images and one reference image in the field. Now adjust the reference image and slightly enlarge it so it looks good. So two axial images have been prepared to be print out. I don't know how I always take time adjusting the contrast. I take time to be satisfied in the filming. I don't know why. So this is a T1 in and opposite faced. So I have to print the in phase image. This is opposite and this is in phase. This is the second series. So I am selecting the second series, that is in phase, and also in the 4 into 7 layout, and copying the reference image from the previous film and paste here. So three axial protocols have been prepared to be print out. These all are pre-contrast protocols, normal sequences. T2 has transverse, T2 trophy fat shape transverse, and T1 opt-in transverse. And now I will go for the diffusion. So I will find out the diffusion images, and this is the I will have to take the B1000 value series from the 3 series. You can see on the top, sorry, bottom right bottom corner, sorry, left bottom corner, that there is the value B value is visible. So this is T2 hast coronal, T2 trophy coronal, trophy fat set coronal, T2 hast transverse, T2 trophy fat set transverse, and T1 oppose in transverse. Now I am selecting dynamic sequences. There is four sequences, as I told earlier, that one is pre-contrast and three is post-contrast. So I am now selecting the pre-contrast one and taking it to the 3D to make the axial images. So I will make the axial images here. This is a T1 by fat set pre-contrast, and I will select 27 slices and drag to the upper part of the lever and drag down to cover the lower part of the lever. So you have to cover all the levers and click start and send it to the filming. And change the layout 4:7. Check out the reference image, enlarge the images. So this is a pre-contrast T1 by fat set transverse sequence. Now I am selecting the arterial phase and drag it to the 3D tab. So this is the arterial phase. I will make the axial images from this 3D application, checking out the images and select the parallel ranges and make 27 slices and drag up and down to cover the whole lever, and thickness is 3. Click start and save as, and right here the arterial phase, and then save and then send to filming. Go to filming, then change the film layout 4:7. Sorry, I have to make it 4:6. And check out the reference image. You can see that I wrote the arterial phase is written in all the segments as a comment. When I make this film in 3D, then save as arterial phase, I write arterial phase, and then it is as commented as arterial phase in the film. And now let's go for the portal venous phase. Drag the series in the 3D. Now in the 3D tab, on the coronal image, click the parallel ranges and change the number of series to 23 and drag the slices up and down to cover the whole lever, and click start and then check out the image, then save as and write portal venous phase or PV phase in short, and then OK, and send it to the filming. In the filming, change the layout of the film to 4:6 as I make 23 images, and there is one reference image, total 24. Adjust the reference image and also adjust the portal vein images to fit in the segment. So this is the portal vein film for liver. You can see that the portal veins are highlighted. in this face, and also the liver parenchyma is brighter here. And print out. Now I will check the venous face. So this is the venous face, and from the venous face I will make again 20 23 axial slices, and again drag up and down to cover the whole liver, and click start, and then save as venous face. Write the venous face or V face, and click start, close. I will not print it out, just save this, but I will print out the coronal one. So this is the venous face. You can see that the V face is written in the bottom, and now I am measuring the lesion from by the scale, and this is a 3 centimeter width and 5.74 centimeter length. So I have changed my mind. I will print this and select the series and send it to the filming, and in the filming 4:6 layout, check out the reference image, adjust the reference image and print out. And now I will go for coronal. So drag the coronal protocol T1 Vibe headset coronal to the 3D and make coronal films. You can see that face overlapping artifact, wrap around artifact actually, also face over sampling. So I will make coronal images, 23 coronal images, and save this, and from the browser select the coronal images that I make, and in the viewing I have find the lesion and measure this measurement. Giving the measurement of the lesion is a good practice, so always try to give the measurement if you find any lesion, and small or large, and if any stone, any cyst, always try to provide measurement. And for coronal image I will select 4:6 protocols and 1 reference image. So this is the last frame that I will print out. So thanks for watching. If you like this video, please hit the like button and don't forget to subscribe my channel.